Good afternoon, everyone. Really great to be here. Been a huge fan of Matter and attending Lunch and Learns. I looked back all the way back to 2017. So thrilled to continue to be a part of the community and contribute in any way I can. Today, we are covering innovation doesn't always mean disruption. And what does that exactly mean? Well, overall, we're basically going to be walking through innovation, disruption. What does that mean in the context of healthcare, and specifically the who, the why, and the what of what feeds into truly meaningful innovation for the healthcare experience and across the full value chain. Along the way, I'm going to add some little tidbits and learnings that we have from 10 Pearls and allow us to kind of maybe look at things through a new perspective as we all ideate, build, and deliver new opportunities to the market. And really talk about what is that true delight that comes from innovation and then downstream, hopefully more systemic disruption. But first, hi everyone. My name is Jill Dillingham. I am the Vice President of 10 Pearls Health. I live here in Chicago. I've been here pretty much all my life. As a bit of background, I started my career back in the Stone Age with Arthur Andersen as a healthcare consultant, yeah, Stone Age. And then over the past few decades, I've moved from the healthcare sector, then over to advertising and into sales operations, and now back again in healthcare as well. All of these roles that I've had have had a bend towards innovation and transformation. It's something I'm incredibly drawn to, of building and pushing the envelope on what is possible and what makes things better. And when it comes to healthcare, my personal value prop is lifting the experience and the outcome of the individual. I truly believe that if we start and when we end with a happy and healthy individual, that we can turn this crazy industry around. But I digress. So, and feel free to throw in, what your passion is around being a part of the healthcare value proposition and where you fit into the chat. I know we have a representation from pretty much everyone across the chain, from pharmacy to payer, to early stage ideator to investor and executive and everywhere in between. So excited to understand and hear what resonates with you as we kind of delve into what innovation means specific to healthcare. Also, at this point, you're probably wondering, okay, so what is 10 Pearls? Yes, 10 Pearls is relatively new within the healthcare landscape, but 10 Pearls has been around for a little while. It was founded in 2004 outside of DC and has grown into a global team of 1,200 strategists, technologists, engineers, designers. We have an incredibly deep bench of incredibly talented individuals. While our roots are in supplying our partners with that deep bench of expertise to get initiatives across the finish line, today we really serve every sector in every manner. And that includes, of course, now healthcare. Our teams not only help strategize and design to deliver on everything from AI to cybersecurity. We take great pride in the fact that we get to do that all under one roof in one cohesive team available to all of our partners. So getting into it, I have always loved this quote. As builders, innovators, founders, whatever may best describe what role you play, we have the distinct luxury in the healthcare sector to not only gauge the success of our light bulb moments by the numbers on the spreadsheet, but also by the anecdotal impacts our transformative ideas can have on a life, on an individual. And that can be the patient, the member, but also someone who is working day in and day out at a job that sometimes can feel like they're pushing a boulder up a hill. We are also creating relief and delight for that individual on the business use side of the aisle as well. So innovation, and innovation does have broader definitions, but it does mean different things to different sectors. Overall, it absolutely requires the encouragement, collaboration, and communication, and it implies clear steps must be taken. It's the start of something great. And when all of these items come together, that is innovative. And what happens after that is the transformation, the implementation process following that first spark of innovation. And put another way, innovation really is it's just plainly the rethinking or reimagining of a business process that already exists. That's it. And innovation can occur anywhere along that value chain and with anyone. And for what we're talking about, that's the clinician, the patient, the member, the agent of the payer of the organization, the executive, all of the above. And whatever new approach that creates, it's a ripple effect that results in an optimized outcome, be it with the business or the clinical case, or most importantly, with the well-being of that person again, or even their caregiver. It all ripples out. And when all of those things are lifted, we have true transformative innovation. One inherent trait I really like about disruption is actually the underlying conflict in the connotation of the word, and then its application towards innovation. To disrupt is negative, but maybe I'm just a little too Gen X, that being disruptive was always frowned upon. And since I am the outspoken, filterless eldest child, I do get a kick out of working towards disruption as a positive, getting out of the norm, not being comfortable. It's an asset, something that has value to business cases, but in a context of healthcare, it creates relief or delight for someone or something across that landscape. It's not a negative, it's a giant positive. But yet for healthcare, disruption is inherently difficult. And that's given the huge variations we have in patient profiles alone. A comparison I make all too often in client discussions is, have we considered how this will affect my dad in New York City versus my grandmother in Central Kansas? Healthcare is a proposition that doesn't lend itself very well towards blanket rules. So that's one of the reasons why disruption is a little bit more difficult to achieve. On the business side of the coin, we see an equally fragmented and complex landscape. It's full of incumbents that have a litany of blockers that stand in the way of innovation within the full landscape. Innovation within the business itself, we can get there. So don't get me wrong or be daunted. These are all huge opportunities for innovators that are ready to roll up their sleeves and start helping from the community level up. So accepting variations across the geography, stakeholder, patient, on and on and on, the best place to start is seemingly with the boots on the ground. And stepping back, I think, to the last slide, what did it say? Significantly altering the way consumers, industries, or businesses operate. As innovators, this is our North Star. So let's start with clinicians. They're the front line. What do they want and need? How are we fulfilling their needs? Well, one, they're all saying, reduce my admin burden, reduce my admin burden. Reduce costs. They see it within the landscape of what the pain of the cost of care might be, even down to their own paycheck. And also creating efficiencies for quality. Big asterisks right here. And pause. We're at a point where many hospital administrators look at novel technologies and wonder, how can they give nurses 2 or 3 more patients? Well, nurses, on the other hand, ask, how do we make our lives easier without making a mistake while improving patient care and maybe getting a lunch or a bathroom break? Systemic innovation and disruption cannot be a game of whack-a-mole. It actually has to lift both of those. And there has to be that alignment, that communication across for it not only to be innovative, but also lead even further to something systemic. They're also asking for digital equity. Again, back to my statement of, does it create the same impact in New York City as Hoisington, Kansas? The disparity of technology between patients, providers, and even payers can render many innovations truly not scalable as a blanket rule. So we know what the issue is on boots on the ground. How do we begin to solve for those one by one by one? Now, while this is definitely a harsher quote out of Health a few weeks ago in Europe, it does have merit. Even the best innovators can lose the plot somewhere along the journey. It is very, very tempting to say, I've got this thing, this is going to make all the difference. Well, and then it's the journey of standing it up in the real world that is really going to be the proof that's in the pudding. And this is where we really want to take a step back and say methodically and with eye on the prize, how am I going to deliver something that is going to have lift to all of those that are affected? So moving on, let's consider what the health providers, the payers, what are they looking at? What are they needing the innovators to bring to them? So considering again, back to a couple comments about the state of the incumbents and the blockers that they might have within their own systems, architecture, or landscape. What does this group really need? Where are the new ideas, platforms, tools? Where are they really going to heal their ailments? There's a Deloitte study from 2021 that I really like and still rings very true. It's given the girth of the legacy systems, the siloed data that doesn't flow across the value chain, or even the nature of the organization's P&L. This is a hard truth. The structure of today's healthcare entity makes achieving and implementing innovations, just innovations, even more difficult. They lack the access to data, or the quality of data might not be what they need or in a format. They lack the talent internally to build or maintain those next-gen tools or systems, or they just don't have the budget or proof around ROI for that investment. So given what we know about what their needs are, what their pains are, how do we dovetail and fit together our opportunities to add value to that experience in this business case with the parameters that are provided with us within the payer or the provider system? Another North Star that needs to be adhered to. And to back that up, the first question we have is, how does this attach to the KPIs we have in the organization? The decision is made by the highest level of the organization. It comes down to, is this fantastic? Is this going to transform or do something that will move the needle on our internal bars of what we have to hit as an organization for not only our business case, but for those that we serve? And it does end up sometimes being that black and white. I spend all my time talking to systems and payers, and from where they sit today, at the end of the day, any innovation, any new opportunity, it has to have a very enticing lift to a KPI across the value chain. They need to be able to see downstream what it will do, not only to that specific stakeholder, but across the entire scope of the journey. And finally, what does the patient, the member, the caregiver, that final end user, what do they want and what do they need? Technology that works for them and that meets them at their level. I think very often we all consider our own needs. And again, back to the statement of New York versus Kansas. That's a very, very wide breadth of needs and levels at which they want to be met. Very great challenge to rise to. Patients want technology that makes it easier to access their records, schedule appointments, and communicate with their doctors. They also want to be able to monitor their health and automatically send updates to their doctors. And I've seen some incredibly amazing innovations that not only make it easier, they actually want to engage. We're there. We have the opportunity. Now it's just connecting all of these together. And it starts with a boots on the ground, what serves this population and this individual. They want to communicate with their healthcare providers and that active listening to really understand them, their symptoms, their feelings. But big note, this is exactly what we just talked about with clinicians wanting to reduce their administrative burden. These two key players are asking for the same thing. They have the same pain point. This is where we find innovation and opportunity to actually not only ideate, build, but also deliver verifiable delight to a population. If we delivered on this one item, the downstream effect would be nothing but positive. Rinse and repeat, keep going. Then we end up closer to disruption. And this all is very, very anecdotal, but that's actually the good news. We measure everything in healthcare. There's KPIs, there's a number and a metric for everything. So I'm going to give credit to my husband, who is also a healthcare consultant. So it applies here. My husband, Scott, is famous for saying, not only in professional settings, but at home as well, interesting, not helpful. And maybe the best innovation we can create isn't necessarily disruptive in the best sense of the word, but instead helpful to the defined entity or population it serves. Helpful does yield the KPIs that do warrant the business case. So from anecdotal to the metrics, helpful yields actual value and merit. And when those learnings can then be translated to other populations or other business cases, that's goalpost. If our tools and products aren't helpful to the business case or user, then they simply fall under, well, interesting, not helpful. So with that, where does your offering, what you're tackling fit into the landscape? I'm going to pause here for a moment, and I'm going to allow you to kind of take a moment and consider, our beleaguered healthcare system and what value you are trying to add to it. What is your individual value prop? Okay. Now that we've got that, who is it benefiting? We really, really focused in on the patient, the caregiver, the nurse, or are we focusing more in on the business side of the coin? Is it someone in claims? Is it behavioral? And what is the benefit to that specific person? Is there an associated metric other than the anecdotal that we can attach to it? And is that within the top list of what they're looking for? And now consider the greater landscape. Look for that ripple. What else? How else can you paint the picture in your story of the value it adds to the full journey from initial to the final claim adjudication outcome? This ends up being where we maintain our focus as innovators to understand that we are truly creating not only innovation, but value that can lead to disruption. So some of the ways 10 Pearls Health has ideated, built, and delivered innovation with a focus specifically on what our clients and what the clinicians, the business case owners, and ultimately the patients or members want, has always been central to what we do and how we approach our relationships and the value we add to our partners. The translation, got 3 here. The first one being an interpretation platform. This was an opportunity for us to not only, when considering those individuals that we just covered, it was about creating the ease, creating comfort, not only in physically they were going to be taken care of, but that they were also heard. And then operationally, that there were not going to be errors. It was not going to actually extend out the care period, or that information was not going to be adequately captured. This lifted both NPS scores and operational efficiency as well. Telehealth. Everyone's really great on trying to fine tune and tinker and level up the telehealth experience. Our experience has been specifically this one in behavioral that opened new opportunities for the clinician and the patient interaction that resulted in metrics and scores that showed efficiency and timely treatment, as well as not only fabulous reviews and happiness and brand allegiance from the patients themselves, but that beloved NPS score, which is even more valuable when it came to their STARS calculations. My favorite project thus far that I think really does this and breaks down those silos that we see on the provider payer side and kind of gets rid of the clunkiness of the legacy is a digital management solution that was built, the Clinical Access for Equity. It removed those silos across the business units and actually across states, that created a clinician-facing member snapshot. It reduced the administrative burden. It got right to the meat that the clinician needed to have an adequate and effective treatment time with that individual, in which they were more facing than facing the terminal. And it gave that member in turn, that patient in turn, the individual attention they deserved. And there was a great big fat whopping reduction in admin costs that we could also just show as well, that quickly reinforced the value and the ROI on the project as a whole. And these were more boots on the ground, more single payer, single entity, single digital health platform. And it's now something that can be dynamic enough to spread to become a more transformative innovation across the broader landscape. Ideate, build, deliver, and delight. At the end of the day, what we do in healthcare is so much more than innovate, transform, or disrupt. Our success is tied in thoughtful and verifiable impact on the business and the person. It is both. So a little proprietary give from the 10 Pearls thought process. Based on all of our work with clients, one thing we do is we hone in on the specifics of not only the population that they serve, but also the business. And we stay focused within our process, be it a stack assessment, a modernization, or a build from the ground up. We root that process in the 3 stages of empathizing, strategizing, and designing. And it allows us to keep all of those individuals, all of those players, all of those business cases within our crosshairs at all times. So first, empathize. We make sure we are marinating in the who and what we're solving for, what we're relieving. The context of this specific organization, this population, so on and so forth. What those user pain points are, fleshing out the full personas, and really doing our research and homework on the specific case here through the insights, the research. Here's where we can start also checking our work along the way to make sure that we're still on task. It's, for instance here, change rejection or adoption rates. Is the solution improving or deteriorating in the user experience? Is there change rejection? Why? Why are we already, the light bulb moment, how are we already here? What does adoption look like? What are those red flags? And how does that impede or aid the value of what you're delivering? I, even as a founder early on, thought that I was definitely going to have one specific group or cohort as my main target for relationships, and it turned out flat out wrong. The idea itself was still spot on and still had the value. I needed to go about it another way. My change rejection and my adoption rates truly were the key that kind of made sure that I'm empathizing with the wrong group or in the wrong manner. Strategize. Can you bake the cake with the ingredients at hand and in this kitchen and have it ready on time? That's what your strategy is. How are we getting from here to here? I once was working with an organization that truly were ready to add value to the growth strategy within a whole new sector. They had been really only serving one group for a very, very long time. And the platform that they had absolutely lent itself and really would address a huge hole in a whole nother market. Well, they just went ahead and said, well, if it worked over here, it should work over there. They wanted to bake their cake with different ingredients and in a different oven, but yet have the same outcome. It does not matter if it is a health system or a population in one area. You really have to get dirty and roll your sleeves up and really address this group, this task at hand. What might need to be tinkered or flexed so the group over here or the project over here is going to get the same reward and same value as what you're doing with the right hand. Design. These truly are your finishing touches that close the loop on the innovation and then earn the moniker of transformational. It also then requires the beginning of the process all over again, and we have to innovate on that and move on and move forward. But including your OKRs in the assessment really does allow you to paint the picture of how high you thought you'd reach and where you'd hit it in reality. In a lot of ways, design is that icing on the cake that really truly reaches the top of what the value is on this innovation. So I've hit repeatedly on happiness, relief, satisfaction, delight of a more defined, maybe regional or smaller group of people or specific business cases. And that can be anyone, again, across the entire healthcare value chain. But with that, I hope that we've at least shared some thoughts or gotten everyone to think a little bit more granularly of the methods of how you are on your journey of building and ideating and delivering, and that there might be some items that have resonated with you on what you're tackling today or in the past. At this time, again, thank you. I'm going to open up the group to Q&A, comments, feedback, any of the above.
Hi, Jill. I don't know if you can hear me.
Yes. Hi.
Hi. Very interesting. I have a question about innovation. I understand your approach, but the difficulty sometimes is to getting to be allowed to do the innovation. Usually the entrance barrier is extremely high because there are a few mega kind of corporations which actually keep their clients hostage. And so it's very difficult to even go if you have the technology. So I will give you, and I have a question for it. I apologize for maybe rambling a bit too long, but I did IT infrastructure for healthcare before, and now I have a complete open source technology which is scalable, which has both EHR and genomics and artificial intelligence, and it's open source. So there's nothing better way to scale and to provide value. But the problem is that the end users have no decisions about it. And so the people who actually can pay you, they're a barrier. So the question is, how do you see that? And can you give an example of your implementation? Like one real life examples of where Pearls have helped an organization. How did you go about it?
Sure. So what I think I'm hearing, please correct me if I'm wrong, is that what you have available is something that really brings a different outcome to the value proposition around health records. And is that person that it's ultimately benefiting, is that the individual patient, or does it create efficiencies more on the business case side?
Well, involved. Basically, I think the freedom would be when you have no need to be tied to Epic or anything. So there are both being open source. The client have all their data on their own EHR, and the clinic can implement it. But how do you get about overtaking Cerner or Epics, because they are fiercely protective? And that's my question. It's interesting. That's why I'm interested to see how did you implement your innovation, and if you can give examples of how Pulse have provided concrete solutions to someone.
Are you one more question? Are you approaching kind of from a development standpoint a direct to health system or provider, or are you trying to court the Epics of the world?
Well, I'm curious to see how do you approach it. That's my question.
Sure. I think the same way. So I alluded to when I had my own, when I was my own founder, which I still am, but that I truly thought it was a B2C value proposition. That at the end of the day, the security, all the things that I was creating really were around the individual. And what it turned out was they didn't want an additional platform. They didn't want to move away from their incumbent, which actually was either their banker or their wealth advisor in this instance. And instead, I quickly through a lot of just conversations. I mean, I cold call. I have something, I'd love to hear your reaction to it, was my literally tattooed across my forehead for a period of time. It turned out that estate planners and wealth managers, saw this as not only an acquisition, but a retention tool. And that's where the value laid, is that they were willing to implement, to have this available as a perk to their clients, because it made their funnel, top of funnel, faster. And it also added to the long-term value of those clients. So it took me really understanding that while I was seeing this amazing outcome and relief and efficiency on this side, what I was actually missing was that my entry into the market was actually going to be over here on the right side through more of a B2B proposition. So my advice to you is to have every single conversation. If I had actually found out that it was actually going to be a community government, I would have gone that way through the Department of Aging and so forth. So literally doing your own discovery over and over and over again, and understanding who's going to see the best value in it or want to activate your opportunity. And it could be epic. It could be at a health system level. It could be at a practice level. It could be, I'm thinking of even other cases around brokers. But to have every single one of those conversations, you get to keep your cards close to the vest, and they might want you super fast. Don't be afraid to have those conversations either. I was always scared to I felt like I was giving them something and then they were going to go, well, we can just build that themselves. What it turned out was, no, they would rather acquire or invest, because either the systems they have are not allowing them to actually fulfill that. And they might have already realized that and are waiting for someone like you to come along.
Thank you. Thank you. I really appreciate it.
Great,
All right,
thank you. There's a few questions in the chat, Jill. Would it be most helpful if I read them to you, or would you like to see them and read them?
Why don't you read them out so everyone knows which one we're on? That'd be great.
All right, perfect. So this one is, I'm a clinician. My question is, when exploring an innovative idea that you don't have the technical skills to build, what would you recommend would be the best approach?
Dana, I'm going to let you in on a little secret. I don't either. I don't. I have a degree in economics. I have just learned along the way. And me as a founder back in 2017 versus where I stand today in 2024, having worked with a lot of really, really smart people and gone to every meeting, every association, Matter, 1871, that is where I got my chops. And no one expects you to know everything at all. And no one expects you to go at this alone. You need to find somebody who speaks that language. You're one side of the coin, they're the other. You're going to hear that a lot within the investment community of wanting to talk to and engage with organizations that have representation of both. You can be an amazing engineer, builder, technician, but there also needs to be that other person that can be more the anecdotal, paint the picture side and the management side, and what the actual effect is, who's going to be able to go out and have these conversations. So you need to find a co-founder, or at least someone that's willing to put in some sweat equity. You can absolutely go to coding camp and do all those things. I personally spent 3 years working out of 1871 in Matter, and appreciate every single moment. And you know, it's still to this day, I would still need to have someone with my back on any technical side of any new innovation and anything I'd be bringing to market. So you're not alone.
All right, thank you for that question. The next one is, how do you find healthcare systems take the first step into innovation without a big commitment? For example, smaller trials, simulations, or other methods that, excuse me, simulations or other methods that give indicators or necessary data to present to a board without a full commitment.
Definitely. Proof of concept. Can we do a proof of concept? And pick, all right, we know this is something that's going to change the status quo. Which scenario are you tackling as a health system is the most painful, needs the most attention? I covered in those three opportunities that 10 Pearls has built from the ground up, one in which the member snapshot, that started off as behavioral health only. And based on the wild success there, it was a do not pass go. So it's, you're nodding along, health system, that this has value. We can see it. Let's pick a scenario and stand it up, measure it out, and then also we'll know exactly how to scale it out. So it's just asking for that proof of concept with that one right partner. And then your values.
Great, thank you. Next question is there any guidance for when KPIs are nebulous because existing solutions don't perform well? Say in the instance of LLM diagnosis for uncommon conditions, my intuition would be to reduce false negatives or something like that.
Oh, this is a tough one. These are the ones that are always going to be outliers, in which healthcare is always going to be driven by individuals and face-to-face and review. We have a claims project that with pre-auth that heavily relies on tying up and matching out diagnoses and all of that data and information, but it can still come up within a gray area or not within a parameter. Those still need to go to an individual for review. So those diagnoses that truly are within the outlier and don't lie within that bell curve that even our APIs or the predictive analytics can spit out, those are still going to require that human interaction. If you can actually push the envelope on the next generation of what something in that, like that claims matching, and move the needle on the number of exceptions, then you're sitting on the next wave of the next iteration of innovation to transformation.
Great, thank you.
Vanilla answer, sorry.
And then the last question we have right now is, what are your best step, perhaps to avoid mistakes, recommendations for women founders with verified patentable health tech innovations who are being encouraged towards NIH funding?
Get a lawyer. Lawyer. I had a fabulous lawyer. And actually, for a period of time, I even used the University of Chicago law lab and still speak to one of the law students that worked on my venture very, very early on. I would absolutely also find someone within the development world, and that could be someone who's getting dollars for Pause Chicago or politics. Someone that knows that landscape. And NIH, that you need someone on your side and an advocate who speaks that language. Just the same way, none of us, I can't do my taxes, and right now my CPA wants to wring my neck about what my QuickBooks looks like. You need to have someone that has either walked the walk and can protect you not only legally, but also understands the nuances of basically funding an entity in this manner.
Perfect, thank you. Does anyone else have any other questions, whether it's off microphone or in the chat box? I think we caught all of them. And in the meantime, Jill, any parting thoughts for our group?
No, it was a pleasure walking you all through this. I, again, hope that at least there was a couple of nuggets in there that resonated with you, or gave you a little bit of pause to kind of ideate or grow even a little bit more. I am always available to chat and bounce ideas. I do believe in one good turn comes from another. So I might end up with the same favor back at you. Available on LinkedIn as well as through 10 Pearls. Please connect with me, reach out. Happy to answer any questions one-on-one as well.
Perfect, thank you. If anyone else would like to get in touch with Jill, feel free to reply to your Eventbrite ticket, and then I could pass along your message to her and the team. Great, thank you so much.
Thank
All
you,
right.
everybody.
Thank you, Jill. Thank you, 10 Pearls. I know we have another team member on. Thank you so much. And we hope to see you at our Lunch and Learn next month with Meg. So she'll be leading another 10 Pearls session for us. All right. Thanks all.
Thank you.